All right, everybody, welcome. I'm excited to be joining you all here tonight. My name is Dr. Andrew Roop. I'm going to be going through our webinar tonight. We're going to be talking about colic, sleep, a whole host of newborn challenges. And really, what's going to make this the most useful for you, which will kind of take some time here to let people join us live. But that is the people joining us live, because you're going to be able to shoot us some questions. You're going to be able to share thoughts, share your situation. And we're going to do our best to address those challenges and give some helpful tips, some pointers, some things that we can go through to make sure that you are getting the most for your newborn and just really make sure they're thriving, right? That's where our name comes from, because we truly believe kids and families are meant to thrive. So quick housekeeping here. Let me just double check in, making sure Facebook is rocking. If you ever see me looking down, looking up, looking around, it's not because I'm trying to ignore you, my virtual friends here. Just making sure we're live and streaming elsewhere good. Awesome. So I see this on Facebook. I'm going to make sure we have people joining everyone there. Perfect. So that's what we're going to do. We got a couple different options here for interaction, for sharing questions, for sharing thoughts. Some of you might be joining us on Zoom webinars. There's a Q&A box somewhere on your screen, on your phone there. Hit that, ask a question. I'll do my best to monitor that. Also, on Facebook Live here with the Thrive Chiropractic page, not a single person looking at this isn't familiar with Facebook, so I don't need to explain to you how to comment, how to interact, how to share things there, because that's what we do every day, right? So I'll be keeping tabs on that to the best that I'm able to, make sure we answer questions and address that. Even if you're not watching this live, say you're watching this tomorrow or next year, next month. Actually, we had some people emailing us asking for a recording because they're overseas. They found out about the webinar, but they don't want to wake up at 3 a.m. right now to be watching it. If you're that person here, still drop a comment and show it on Facebook there, and I'll do my best to get back on and answer those, direct you to the resources you need and whatever we can do to help. So that's kind of how this is going to work, this webinar format. If you have any questions, throw it in there as well. So you might be wondering, if you're not familiar with our office, if you're not familiar with what we do, you see Thrive Chiropractic, you saw it being shared on Thrive's page, you're wondering what the heck does a chiropractor have to do with newborn challenges, with colic, with reflux, with everything that we're going to be going through. The reality is, at Thrive Chiropractic, we're a pediatric and prenatal family-focused office. So this is our world. This is what we get to do and to help families with each and every day. We love it because that means we get to hang out around with cute and cuddly babies and crazy little kids and help moms rein them all in and handle that world better. So that's why we're sharing about this, because this is what we do with that unique pediatric and family focus here at Thrive. We always get the question of, do you guys see adults too? And we certainly do, as long as you're not a grumpy adult. We don't want anything to do with that. But yeah, we love to help out adults and families. But our real passion, our focus is on kids, and especially kids struggling with some of the stuff that we're going to be talking about tonight. If you're a parent who's either right now got a newborn who's dealing with colic or reflux or any of these challenges, you are probably tuning in and hoping for a miracle here, right? Because you know how impactful that is on your family. You and your spouse are playing tag, going back and forth each night, because you can only take so much of the crying, of the fussing, of the wriggling, of the tension. It wears on you. It wears on you emotionally, because you feel guilty, you feel at fault. It wears on you physically because you're not sleeping anymore. It just wears on your mental, emotional, physical state, especially the emotional one. I think that's a quick that's a deep issue for a lot of moms and females, because they're so quick to want to solve all the problems for their family, and it's the most, I say that as if it's a bad thing, right? That's what makes moms moms. That's why that's why the world goes round and why we're able to all be here, because the ways that moms put everyone else first and put themselves last. But as that, you feel guilty. You feel like you're doing something wrong if your newborn doesn't seem comfortable, if they don't seem like they're at their best, or they seem like they're gassy or bloated or anything that's not right. You take it upon yourself and you think, oh my gosh, I did something wrong. You doubt yourself, you blame yourself, and that's just not okay. That's why we love helping these families. We love helping these moms, because our goal and our mission here is to empower families to thrive. We want to make sure that you, as the leader, the healthcare, the decision maker in your family, along with your husband, your spouse, we want you to really take the reins and be able to be heard and respected and listened to as that director of your kids and your family. So one thing that you've probably dealt with before, if you've maybe shared some of these struggles or shared some of these issues with your healthcare provider, is you're discarded. You're not really given the time of day, which we hear frequently in our office, and it saddens us and frustrates us because as healthcare providers, that's kind of our number one job, right? Is to listen to the patients, listen to the people we're caring for, and hear them and try to either one, address those worries if they're legitimate concerns, or help share some hope and answers and understanding there. But the worst thing and the thing that frustrates me most is hearing from parents that they feel like they're not heard, they're not listened to from their doctors. And that's not okay. That is not okay. We want to encourage you to trust your mom instincts, trust that gut instinct, that feeling you have of something's not right here, or this isn't how I expected it to be, or whatever that looks like for your situation. Trust your mom instincts and know that more often than not, that's going to get you on the right path. That's going to lead you to the answers and the help that you need for your family. So that's the first thing we want to share right after that is trust yourself, mom. Be that leader, that healthcare overseer for your family, and don't let anyone else turn away from you or not give you the time of day or not hear you out on that. Here's something we have to remind patients sometimes, or friends or family we're talking to, is your doctor works for you, right? You're at the liberty to fire them and find a new one. If you feel like you're not being heard, if you feel like you're not being respected, maybe that's not the best office, the best personality fit for you. So one of the things that you've probably been told then is that these challenges or these issues that you and your newborn, your family are struggling with, maybe they just say they're normal. It's something you just got to deal with. Nothing you can do about it. It's normal. Another common thing you might hear is they'll grow out of it, right? Everything will be okay. They're fussy, they're crazy for a little bit, but they'll grow out of it. And the reality is that I think we need to differentiate between a couple words here: common versus normal. Normal is how we're supposed to be functioning. That's everyone's at their best. That's everyone's at 100%. That's thriving. Common might be what we see frequently. That might be something that is happening with most people these days, but that does not mean that it is normal. So there's an important distinction, important differentiation there that we want to really emphasize, that common and normal are two different things. Just because your doctor, your healthcare provider, or you as a circle of friends and people that you're around, just because you're seeing something happening frequently and you say, oh, that's common, everyone's got that, everyone's got ear infections, or every baby cries, or they're all constipated, that's not normal. Babies should be pooping regularly. They shouldn't be crying unless they have a specific need. They shouldn't be getting ear infections and on and on and on. So we need to trust that instinct, trust that drive you have, that no, this isn't normal, this isn't okay. We need to figure out what's going on here. So the other thing we talked about there, they'll just grow out of it. What we see time and time again with our work with kids with neurodevelopmental challenges and struggles later on in life is we see the same baby steps initially. We say traumatic, stressful birth with these newborn challenges leading to ear infections and strep and allergies and asthma and sensory challenges and ADHD. And it's this whole confluence, this perfect storm of challenges where no, they're not growing out of it. It's just growing into another problem because there's the same underlying causes, the same underlying stresses and imbalances in their body. They're not going away. They're not growing out of it. The problem or the symptom just turns into something else. And a lot of times it's something else that's more serious, that's more troublesome or burdensome for your family. So just making sure we're not missing any comments or anything like that here before moving on. Our goal tonight here, we're going to go through a handful of different things. One, I want to make sure that you guys have helpful tips and strategies and tricks that you can do at home with your little one, whether that's dietary things or infant massage or anything along those lines. I want to make sure that you have some tips and strategies that you can do when you're at your wit's end, just trying to get through the night or get through the day. Another thing, I want to talk about what is going on here, why they're happening. Because if we understand why these challenges are taking place, that really leads us to the solutions, understanding how we can best help and get to the root of the problem and then solve it and go from there. So that's another thing we want to make sure we go through is what's going on, and we'll make sure we understand a little more of the science behind this. Science might be a scary term for you. I myself am an avid science nerd, a self-proclaimed science nerd. But we'll make that simple. We'll make that easy to understand in simple terms for you. So we're going to make sure you go home with action steps that you can put into play to help your newborn be at their best and not be dealing with all these struggles and challenges. So we've got a whole host of things that we mentioned here, right? We talked colic, sleep, reflux. We've mentioned constipation and some other challenges here. A lot of times, and maybe you yourself, maybe your healthcare professional is thinking about those as completely separate areas. You think, okay, the sleep issue, maybe that's a behavioral change you need to make. Maybe that's a psychiatrist or a neurologist issue that they need to address that. And reflux, maybe that's more in that ENT, upper GI world. Colic, oh, that's a gas issue, so we need to send them to the gastroenterologist and they'll do this, that, and the other. We kind of compartmentalize and separate these challenges out. And I don't think that's doing us any good. What we want to look at tonight is showing how these are all interconnected and they all have that same common cause and imbalance in stress in the nervous system. You're going to hear me use that word stress a lot. What we mean is that, and that's the word really that we hear moms use to describe their newborns that aren't at their best. They're not sleeping well. They're not comfortable. They're seeming a little gassy. They just seem stressed out, right? Babies should be this precious, mushy, gooey little bundle of joy, right? If that baby is tight and rigid and arching their back and throwing their head around, that's not normal. That's not how they're supposed to be developing. That's not how they're supposed to be functioning. And that's that stress that we're talking about, that imbalance, that tension in the nervous system. We'll explain what that means. So what is the common thread, the common challenge there? One thing I want to ask here from a lot of you guys, because I'm guessing it's mostly moms that are listening. So whether you're in here live or tuning in later, is your newborn, is your kid one of the ones who loves the car seat, loves falling, or every time you go on a car trip, they're passed out, they zonk out? Or maybe your trick for getting them to sleep at home is you put them in the car seat and then put it on top of the dryer, push play, and that thing runs and baby zonked out. They got that stimulation, that vibration, they love it. And or you could get super fancy. We've got these, I think it's called the mamaroo, those sleeper holder sort of situations that rock and move and vibrate. If your newborn's one of those, make sure you mention in the comments here. Let us know what it is that makes them tick and gets them to sleep and helps them calm down. The reason that I bring that up and the reason we're talking about that is, why do they like that? Why do newborns enjoy that sensation, that stimulation? It's because they're seeking it. They're seeking that stimulation. They're seeking that input because they're not getting it from elsewhere. We're starting to get into that science now. So buckle up. We're going to talk about some new terms. Like I said, we're going to make them simple for you. Really, that big new term for you is the vagus nerve. Any of you familiar with the vagus nerve? It is the most important nerve in your body. And I'm going to pull up a slide here to let us go through this a little easier. Perfect. All right, so we're talking about the vagus nerve there. You see the picture there, it looks like it does everything in your body, right? Pretty much does. Comes out the base of your skull and runs through, innervating your throat, your lungs, your heart, pancreas, liver, kidneys, digestive system. It runs what we call the brake pedal of your body. So that vagus nerve is hugely important for growth, for development, for digestion, for immune system function, which are all the things that we want our newborns to be thriving at, right? That's what they should be doing. They should be spending their time in that vagus nerve growth mode. What's happening, we'll see this graphic on the side here, is we're not getting into that calming, relaxed state. We've really got two halves to our nervous system. We've got the gas pedal and the brake pedal. Our gas pedal, that is our fight or flight, stressed out, go, go, go survival mode, right? That's the adrenaline kicks in. You got to fight the bear and just try to survive. The other side, that's our brake pedal. That is our calming, growth and protection, development, immune system function, all that stuff we were just talking about. The reason there's a lot of overlap there is because that brake pedal is mostly run by your vagus nerve. So that's why our vagus nerve is so crucial and such a big part of this, is because it's running this calming, growth and development function part of your nervous system. When your vagus nerve is not doing what it's supposed to, it means that gas pedal gets turned on. And your gas pedal, that's that stress, that's that tension. If you're in survival mode, you don't really care when your next meal is. You don't care if you're digesting it very well. You don't care how your immune system's functioning. Nothing's as it should be because you just think you need to survive that day, right? And that's what's happening is our kids, these little ones, are being stuck in this gas pedal fight or flight stress mode. Their vagus nerve isn't able to do all these things that it's supposed to do, which is leading to all the challenges. What did we talk about? Reflux, colic, sleep. We can see it right here. If you're looking at our image, what controls whether or not we're struggling with reflux? It's not stomach acid. Stomach acid needs to be there. It's helpful for digestion. The problem is whether or not that sphincter, that hole in the top of your stomach where it connects with your esophagus, the issue is whether or not that's closing and sealing off that tube so that the stomach acid doesn't come back up and irritate the esophagus and end up with the baby spitting up or vomiting. So what's of crucial importance there is that our sphincter, that valve, is shut off and closing tightly. What controls that? Our vagus nerve here. What controls the digestion, the motility, the everything in the stomach? That's the vagus nerve, your brake pedal calming influence. And as a quick side note here, that's why we really aren't huge fans of antacids or even some methods of gripe water for these colicky babies and reflux babies, because that's not getting to the root of the issue. The problem is not that the stomach acid's there. The stomach acid is supposed to be there. The stomach acid is necessary for that little newborn to digest and function properly. The problem is that sphincter, that hole, is not closing off. And that's what's leading to the symptoms and the issues. Trying to calm the stomach acid and shut down the stomach acid just leads to further challenges. That would be like, say you were sitting in your house and there's a fire and the fire alarm rightly goes off and you're just annoyed by it and you're like, stupid fire alarm, so annoying. You just take it off, smash it with a hammer, take out the batteries, you think problem solved, right? No, the problem is the fire, not the fire alarm. The fire alarm is just letting you know there's an issue. So that's like what would be taking place if you try to calm that stomach acid is that's not the actual issue. The issue is that sphincter is not closing. So quick side note there on why we're not a huge fan of those medications for colic and reflux, because they're not getting to the root of the problem and they're creating other digestion issues. So back to this brake pedal versus gas pedal stuff, right? What is pushing someone? What is causing that newborn to be in this gas pedal, stressed out, fight or flight mode? A couple things here. Traumas, toxins, and thoughts. We call them the 3 T's within our office in chiropractic. Physical trauma, a big one for newborns, is that birth process. And that's the one we'll focus on here for a minute, because that is at play more than the other ones there. That birth process, even the most beautiful, natural calm of births, it's a big transition for newborn, right? You're going from cozy, cuddly, safe womb right next to mama's heartbeat, and you're coming out into the world. Maybe that's in a nice calm tub. Maybe that's in a room full of bright lights and people talking and yelling and all sorts of chaos. Regardless, it's a big transition. It's nowhere near what you've been used to for your entire existence. And that's saying nothing to do with anything of birth interventions or anytime we have to add some extra help in that birth process. So say vacuum extraction or doctor's hands were needed to pull and assist in removing baby from the birth canal. That's going to cause a significant strain and imbalance and tension in that baby's neck and spine and nervous system. That's going to lead to this gas pedal being stuck on. It's going to cause misalignments and shifts in these vertebrae. It's then going to affect your vagus nerve and not allow your vagus nerve in your body's brake pedal to function as well as it should be. So that's the big T in newborns, is that trauma. Sure, there could be toxins, there could be dietary issues, emotional stresses from tension or relationship issues with mom and dad there, but the big one is that physical trauma from the birth process and leading to that birth injury. So finishing on that talking about the science here and then how we address that in our office, we're going to use this as an example. So being pediatric chiropractors, we're talking about misalignment, shift, stress in that nervous system. What we do is correct that. We analyze, figure out if that stress, that imbalance is there or not. When we find it there, then we make these adjustments to correct it and bring everything back. So a way we can analyze that, a way that we know how their person is actually functioning and whether they're in this brake pedal or gas pedal mode, is through the scan here that you see on your screen. So this scan, I'm not sure I don't think you can see my pointer. If you can, this top part in this particular case, C1, C2, that blue and red line, that was where we found a significant stress in this case. And this was a kid that was struggling with a little older, so they had reflux, torticollis, but all of the colic and the challenges we're talking about for the webinar tonight, those were all previously in this kiddo's case. So what you're looking at here, little white bars, that's a normal scan. And then green is mild, blue is moderate, and red is severe shift or stress in that nervous system. So as you can see, we've got severe stresses in that top part of this little baby's spine, which is meaning that that gas pedal is stuck on, that brake pedal is not functioning as they should, and they're not going to be growing and developing and functioning as they should. And what you see on the other side there, that fancy brain and spine, that's what we call our fuse box. Just like you've got a fuse box at home and you can go and flip the fuse to the kitchen and your oven's not going to work and your fridge is going to have issues and everything in the kitchen is going to stop working. Same thing here. We can connect the dots between where we see that stress in the nervous system and then how we understand the neurology, how we understand how your body works, leading to, okay, this is what they're likely struggling with. And we see that correlate and line up all the time. For this, so just for this example, this would be a common scan that we might see in someone dealing with ear infections or colic or torticollis, something like that. In a reflux case, maybe we see that stress up top, maybe we see some more in through that middle layer of the spine because they've got the digestion issues and that stress and imbalance through their digestion system. So then what we do, of course, is remove that stress. We bring that back to normal, calm it, and by getting them back to that brake pedal mode, we're able to grow and develop and thrive and do what we're supposed to, kind of our default mode, right? I'm going to jump out of our PowerPoint here. Perfect. So like I've mentioned, I'll do my best to touch base and circle back around to questions or anything like that. But what I want to make sure that I share and touch on a little bit, practical tips for everyone here. So when you're dealing with this in your house, right? You're maybe in the middle of the night, maybe it's between adjustments coming into the office or whatever, maybe you want to know how can I help them, how can I assist them, how can I do my best just as mom and dad to keep them at 100%. A couple different things. One is let's think about diet. If you're breastfeeding for mom, especially, but also for baby, if they're formula fed or starting to introduce solids, anything like that. A common culprit we see with moms' diets who are nursing and babies breastfeeding for the majority or all of their diet. If there is some underlying stresses that baby doesn't seem like they're doing great, one of the first things we can try to have mom do is cut out dairy. That's the most common, most frequent issue and irritant we see both for mom and baby. So we cut out dairy and maybe see a couple days later, you're no longer dealing with as much stress and as much of a fussy baby as you have been. And these are all, I should say, these are in addition or as complementary things that we can do to what we're trying to correct this underlying cause. Because if we just address these issues and not that underlying imbalance, we might help kind of put a Band-Aid or a temporary patch on these symptoms and challenges, but we're not going to be getting to that root issue. And like we talked about earlier, it's going to be likely leading to other challenges later in life. But these are things that we can also do to keep baby at 100% and not have as much of those 3 T's that are pushing people towards the gas pedal. So that's a big one. No dairy. Another one that we see all the time is people are quick to give cereal to their little ones or any sort of grains. They don't need that until way later. Like we'd be completely happy waiting for a year and a half, 2 years before introducing our little one to grains. They should be nursing as much as possible. If for whatever reason that's an issue and you've gone to your pediatric chiropractor, your lactation consultant, all that, and there's just some sort of disconnect, maybe it's an adopted kid, something like that. Absolutely, find the best form as you can, but we want to do our best to get that little one as much of the best food for them, which is certainly mom's milk there. So mom can try cutting out dairy, definitely can hold off on any grains for our little one. If you are going formula, go for the cleaner. Every line, every brand has various grades. There's like the generic one, and then the sensitive and the ultra sensitive, and go for the cleanest one that your budget can afford. go for maybe an organic brand or a more natural or holistically minded brand, because they'll try to have those natural forms of the vitamins instead of the artificial and synthetic ones that aren't able to be processed and used by your little one. So that's one, address diet for mom and baby. Baby wearing, even in from the newborn states, if you find the right wrap for you and for your little one, baby wearing can be an awesome way to keep your little one close and tucked in. The phrase, the terminology we always use is close enough to kiss. You want them, not hanging down low in your chest, but close so you can just reach down, give your precious little newborn a nice kiss on the head anytime that you feel like it or she needs it. But that can really help mom feel free because she can use her hands, she can do what she needs to do, but baby's still close to what she loves, close to what makes her feel comfortable. So ask us for more specific questions there. We can connect you with a local baby wearing consultant expert that can really help you get fitted for different options. But a few rules of thumb for any age of baby carrying is you always want the knees above the hips. So if they're wearing on your chest there, you don't want just a thin strap of cloth kind of going between their legs dangling. You want that cloth and that support extending out to their knees, so their knees are actually raised up higher than their hips were. So it makes this M shape with the knees being the pinnacle of the M. So keep your newborns in that M shape so that their hips, their spine, and their structure is supported. Having them dangling there always makes us cringe when we're walking around the mall or the festival or fairs, because it's this, we love that you're, baby wearing and having the benefits of that, but you need to be supporting legs and little ones a lot better. Otherwise, they might run into issues like hip dysplasia or other challenges. So keep those tight, keep them facing in rather than facing out until they get a couple years old as well. So that's baby wearing. A couple other things here. Along those same lines, as far as stresses and imbalances in the spine, as you're changing diapers, and I'll kind of go sideways here, maybe we can see this visually. Should have brought a baby doll. Most of us, and your kind of first instinct is what? Grab the legs, lift it up, take diaper out, put a new diaper in, or maybe as they get older, you kind of grab them by one side, twist them over sideways. But I would encourage you to try to do, especially in that newborn state, when their stability and their structure is still developing, is gently roll them to the side. Do what you need to do, take diaper out, put new diaper in, wipe, get cleaned up, and then allow them to roll back instead of lifting up. Lifting up, even if you do it with two legs, is going to be causing more strain, more tension on their neural spinal system. And it's a lot easier, a lot gentler for them if you roll them to the side. So there's a little tip on changing the diaper to help minimize those stresses and tensions that you're placing on your baby's spine and nervous system. Another one is a little clockwise baby belly massage. So remember that you can take two fingers, and imagine we had newborn here. Say belly was distended, uncomfortable, they didn't seem right. What we can do is take two fingers and make small circular motions going in a clockwise fashion around their belly. So you can start on the bottom, just work out small little circles going in that clockwise direction. And that'll help facilitate and move any gas along, just help them process and digest better than they should. Like we said, they should be doing that on their own. They should have that proper nervous system function, but maybe we're just starting the first couple adjustments and you're trying to get through those in between days. That's something you can help your newborn do as they're struggling or seeming uncomfortable with either passing gas or trying to have a bowel movement, anything like that. Speaking of bowel movements, you've probably heard that, every 5 to 7 days, that's totally fine if the baby's breastfed, because they just use it all and there's no issues. Breast milk is amazing. It is used incredibly well and efficiently, but they still have waste products. They still need to get rid of it. Your newborn should be having bowel movements every day. Every 5 to 7 days is not normal. Would you be feeling good if you were having a bowel movement every 5 to 7 days? That would be an issue and a problem. And if you are, you probably need to change your diet and get in to see your chiropractor because you've got some gas pedal stress and imbalances in your own nervous system. But hopefully that's none of us adults. Hopefully that's none of our babies. And that's a really common one we're working to discuss with other healthcare providers is that, yes, that might be common with babies and common with kids they're seeing because they're having these stresses and these strains and imbalances from that birth process, but it's certainly not normal and it's certainly not what's best for that newborn. So I'm going to circle back. I'll grab any questions or comments that people have left, I'll make sure we answer them in the thread there. If you're watching this after the fact, you didn't get to join us live because maybe you're 3 a.m. in another country or just trying to put your own kids down or dealing with a colicky baby tonight, send us a message, comment below, and we will do our best to answer those questions. As a thank you for anyone who is joining us here tonight, we would be happy to extend a gift certificate to find out if your baby's having this stress, this imbalance in their nervous system. So typically a new patient with relationship with our office goes through a couple of different steps. The first is what we call a complimentary consultation. That is a no pressure, no sales pitch, just a chance to sit down with us, to ask some questions. And really the goal of that is to make sure that we are the right fit for your healthcare goals and your healthcare needs. Assuming that we are, we go on to that second step, which is our exam and our scans. During that, we would talk about pregnancy, talk about that birth process, see if any of those hidden stresses or imbalances or traumas were involved throughout that. And then we would do our scans. We would do those tests that we talked about to let us objectively measure how your nervous system's functioning and how your baby's doing. After that, we'll sit down a day or two later, have you guys come back. We'll go over all those findings, explain what they mean, explain how it connects to the challenges you're seeing, and say, hey, this is what we can do to help. It'll take this long, it'll cost this much, try to be as upfront and clear as possible and everything. But that I'd be happy to extend and offer anyone who's joining us here a $50 gift certificate off that new patient process. So as you're calling, you're messaging, you're sending us some info or your questions, just mention that you joined us here or you watched this webinar later, and we'll make sure we get you that gift certificate when you stop by for the complimentary consultation. So that's it for tonight. I'm going to wrap up. Last check here. Let me know if we can do anything to help, because our mission, our passion here is helping families, helping kids thrive. We love getting able to do it. So have a great night, everyone. Look forward to talking to you soon.